Okay, I have 1 o'clock and we'll go ahead and get started. Good afternoon and welcome to the long-term care webinar. Today's topic will be an update on life safety and construction of long-term care facilities. Our speaker today will be Dennis Schmidt, who is the Division Chief for Life Safety and Construction. We do ask that you hold all questions until the end of this presentation, or you may put your questions in the chat. All right, Dennis, take it away.
Hello, everyone. Can you hear me okay?
Yes.
Thank you. Real quick, I just wanted to kind of give you a little kind of a bio of myself. I've been born and raised in Illinois. I grew up in Moline, Illinois, northwest corner of the state. I went to school for college at Southern Illinois University in Carbondale, where I received my architectural degree, and I have been in Springfield since graduation 37 years ago, and how time flies. So my background on the private side was we did about 70% healthcare. So healthcare has been in my blood. I did one of my final projects at school on a hospital design. So I've been part of the healthcare movement for years. So but that's kind of my background right now. Live in Springfield. Been here 37 years. So kind of go through our slides here. Sorry. All right. The Division of Life Safety and Construction was established in late 2011, and that was because there were, and this was before I joined the state in 2012. The organization happened due to some issues that related to long-term care surveys with life safety code, and also the disconnect between the hospitals and the life safety codes. So what they decided to do in early 2011 was try and figure out a way to bring everything under one umbrella for life safety and construction. So that's when in late 2011, it was kind of adopted that that's how the Division of Life Safety and Construction became what it is. The first division chief was for that at that point was Henry Kolenko. Henry's been retired for about 2 years now, and has well, almost 3 years, but he's come back on some to help us on 75-day contracts. But he is now fully retired and not coming back. So I'm the division chief since he retired. So we're actually separated into 2 sections. The first one is design and construction, which is what it means. We review drawings and everything. I'll go into that a little bit later. Also, the other section, many of you know, is field services, and that's Bill Myers, and we'll kind of talk about that, and that does the long-term care surveys. This is kind of our organizational chart under life safety and construction. Laura Kramer is an architect. She's the supervisor for design and construction section. And that's who we have as our AA1 office administrator, and all the architects and engineering tech 3s that we have. Bill Myers is also a licensed architect, supervisor for life safety field services. And those are all the surveyors that are in the field, and also some of his staff in central office. Design and construction, with Laura being the supervisor, their responsibilities are plan reviews for healthcare construction projects and renovations. We also conduct on the design and construction, conduct on-site inspections for these projects. We also conduct all life safety surveys on behalf of Centers for Medicare and Medicaid for the non-long-term care facilities. Such, we do sample validations, recertifications, and full surveys due to complaint. On the field services side, Bill Myers, supervisor, their responsibilities are pretty limited to only those annual surveys for long-term care facilities for Centers for Medicare and Medicaid. They conduct with everything from 14G to the full 14 skilled nursing facilities, We have over 1,000 long-term care facilities they survey each year. So what we do for design and construction section, we always try to focus on the skilled nursing facilities and nursing facility projects, because many times the facilities don't understand that project reviews are required in their facilities. And one of the big items that we always say is the clinical teams that go out in the field first for either complaints or the full annual surveys, they're our first eyes on site. So if they see a problem, they see construction going on, please have somebody contact us, and then we can verify that that project is actually an active project in design and construction. Or if it's not, then we have to send out our letter stating that, why are you doing a project? Because it's in violation of the licensure rules and also the act. So, but we look at the facilities. They may submit a project narrative to us. Not every project needs to be reviewable, but we want to know, especially in skilled nursing facilities, we want to know what they're doing, because there's always active residents that are in areas. And if they try to do construction projects in those areas, we want to make sure that the resident, the staff, and also visitors are protected from any construction that's going on. So that's why we always ask we review it. And if we think that it's a project, then we will have them submit. So, and we'll kind of go into that a little bit more in detail. Some facilities may not require project submissions, but that's why we ask them to send an email. In-kind replacements of plumbing fixtures, toilets broke, they got to replace that. We don't require a project submission for stuff like that. Now, if it becomes a wing renovation and they're replacing showers, bathrooms, sinks, lavatory, any of that, then that may become a project. So it just depends. That's why we always ask facilities reach out, or their architects that are working, or their engineers that are working on the project, to reach out to us, and we will make a determination. Wall painting, wall coverings may not be, it depends. If they close a whole wing down, that's a problem. So we need to look at that. So, but like I said at the bottom here, if there's any concern about maintenance projects, please email our office. We're on the phone all the time discussing projects with architects and engineers. Facility items that would require a project submission. Absolutely. If you see replacing of ceilings in rooms or wings, room renovations in the facility, building additions, of course, generator projects, electrical projects, sprinkler or fire alarm projects are a key also. Projects that move walls or doors, projects that would affect sprinkler coverage or fire alarm detection, because those could affect how the sprinkler and fire alarm would activate during an emergency event. These are just a few of the items that we actually look at. There are many more out there, but that's why we always ask for that reviewability letter or email to us. One thing new that's starting January 1st, 2025 is the assisted living and shared housing. We now will require these facilities for new construction and renovation projects that they have to submit drawings to the department for a review. We have finally got that pushed through after several years of working on it. The governor signed it into law in, I believe, July, and it takes effect January 1st. So for those assisted living facilities, they will be under drawing review now. And it's similar to the same process that we go through for the skilled nursing, hospital projects, ambulatory surgery projects. It's the same, similar time frames and similar fees for review. And also we conduct on-site inspections for those too. Another new item that we are looking at trying to incrementally incorporate January 1st is also new project submission forms that will require electronic drawings. So we still require one set of standard size drawings, or half size if we can use it to review. But we're also asking for one electronic set of drawings. And this was kind of generated based on the remote work. And we're trying to make it easier for some of our drawing sets are very large. So if somebody is working remote, that they can access the electronic drawings through the server space that we have. And this permits them to actually do drawing reviews wherever their remote site is. So that's one of these things that we've experimented with on a couple larger projects. And we've got everything seems to be in place to work. We're just trying to update all our forms and get them on the website. So that's a good one that we've been pushing for a while. So this is our life safety and construction website, which we're in time. I think everybody's going to try and get new updated web pages, websites for each of their divisions. So, but this is currently what ours looks like. That has all the forms and comments, questions and answers that we have on there that people can utilize. And a few of the items that are on there, of course, are all the forms that we have for hospital submissions, long-term care submissions, temporary occupancies that we go through, and all the matrices that we require for the assembly ratings, fire ratings, different things, interior finishes. So that's just some of the forms that we have pre-printed out in a PDF format that they can utilize and fill in to help them with their project submission documents or their, at the end of the construction, the project closeout documentation. This is actually one of our final occupancy certifications for request. So we have about 20 items that we request. Not everything is applicable all the time. If a generator project is the only thing, you certainly won't have some of the mechanical issues that are required on there, but they just have to fill this out and tell us if it's NA, if it's not enclosed or enclosed. Federal surveys, we've kind of talked about this a little bit already. What we do is we do sample validation surveys, annual long-term care surveys, recertification surveys, especially for those critical access hospitals and ambulatory surgery centers. We do full surveys due to complaints for hospitals. And we also do monitoring surveys, which most of the time it's for the hospitals because some of those issues that we come across and we have to cite deficiencies may take several months up to a couple years to actually complete. So then we conduct monitoring surveys that are on site. The life safety code surveys, they're all conducted under NFPA 101. It's the 2000 edition, which I still get a lot of comments from several organizations. Why are we still under a 12-year-old code? Well, we follow what Centers for Medicare and Medicaid follow, and they have adopted the 2012 edition. So that's what we follow because we want to align with what they do and what they say. So when they choose to start updating a code year, potentially it could be, they may look at the 2024 edition of the life safety code because that's another 12 years advances in how we've looked at it on our, in the committees for NFPA. So the last one was actually, the 2012 was actually adopted. It took until 2016 to actually adopt the 2012 edition. So it is a slow process. There's a lot of work that CMS has to put together with new booklets and everything and how they interpret the guidance on the NFPA codes. Some of the life safety code survey documentation reviews that we do, we look at fire drills, kitchen hoods, fire extinguishers. We look at sprinkler, fire pumps if they have them. We look at their emergency policies for fire in evacuations. We look at the building history, the date of construction, because that helps us determine if it's under the existing or the new requirements. We do fire door inspections. So if you have fire doors that separate stair towers and that, we look at those inspections. They have to be done by a third-party testing company. We also do fire damper inspections and documentation reviews. That's just a few of the items that we look at during our inspections. We also look at the emergency preparedness plans that each of the facilities provide. Some are very small, depending on the size of the facility, but they have to hit these 4 key, they have to have the risk assessment, policy and procedures, communication plan, training and testing. And we certainly do in long-term care do cite quite a few facilities for lack of emergency preparedness plans that are complete. Some of the facilities, like in some of the hospitals, They could be three-inch, three-ring binders that for their emergency preparedness planning. So very extensive. These are some of the long-term care LSC top-sided K tags. And it's interesting that many of the hospitals and the tags align with most of these also. These are not in any particular order for the number 1 versus the number 10. But cooking facilities, they always look at the exhaust hood and fire suppression. Sometimes those are missed in their inspections. K-type fire extinguishers, they're missing signage, or they don't even have a K-type, which is kind of that silver fire extinguisher that's in the dietary area. Vertical openings, the K311 tags, there's stair, mechanical, plumbing shaft issues. We always find that there are holes in many of these shafts. The other one, electrical power strips, means of egress located, it could be exit signs that are missing, damaged, not functioning, stuff like that. Door locking issues. Is the building permitting residents to exit under an emergency situation or not? Gas equipment, we always run into issues with empty and new cylinders not being identified properly in their storage areas. Fire alarm testing and maintenance is probably number 2 overall for all facilities. Is we are missing reports. Components are missing or damaged in the fire alarms. The number 1 item we always run into is sprinkler testing. Documentation missing. They haven't checked certain older devices that need to be updated, changed, checked. So we always run into that. So sprinkler and fire alarm are probably the number 1 and number 2 for all facility types. Hazardous area separations, that's more for storage rooms. People have decided in some facilities that they're going to convert a resident room into a storage room because they're no longer using it. Well, it needs to be properly fire rated. The door doesn't have a closer. Is it a solid core wood door? So there's many issues that we run into where they just have converted rooms into storage rooms and they don't comply with the requirements of K321. Border doors, many times we run into issues more with the doors in older facilities, especially long-term care, because the doors were all wood doors. And during those summer months, we found that the doors would always swell up a little bit and it was challenging for them to close and latch to their frame without force. So those are always issues that we run into. Also fire drills, missing fire drills. That's a big one. They always, for some reason, it's always those evening, that third shift drills that seem to be missing, or they're overlapping too closely from quarter to quarter. So we always run into those. So these are the Life Safety Code top 10 most cited. So of course, electrical, no particular order. Sprinkler systems, maintenance and testing. That was still part of the previous one. So sprinklers and electrical. This is just some information that we put out there that everybody has to understand that the provider is still fully responsible for compliance with the Life Safety Code. IDPH conducts a sampling of regulatory requirements. We do not have the time and the staffing to conduct a total in-depth above every ceiling tile. So what we do is we have to pick and choose those areas that maybe last year we were in this area, this year we have to pick above ceilings in this area. So we can look at those smoke barriers, fire rated separations between buildings, different door testing, door sampling, stuff like that. So, but the facility is ultimately responsible for compliance. This is the contact information. So if you're out in the field, anybody has, facilities have questions or comments for us, they can always reach out to us at these facilities. Bill Myers Group under Field Services is the dph.field.services, and the dph.design.standards is for design and construction. There's some website information that we have. So these are actually interesting. These are all photos of deficiencies that have been cited. And I will preface this that not all of these deficiencies have been cited in Illinois. Some of these are from, I am on 6 NFPA national committees, and there are many of us on the committees around the country. So what we have done is many people share hey, have you seen this? This is what we're running into, stuff like that. So these are some of the oops that we find. Some of them are from Illinois, but no facility has been identified. But some are also from other areas of the country that people have seen these as deficiencies. So some of them it's entertaining, but it's also a learning experience. So if you see some of this when you're in the field, you need to notify the facility maintenance person, the administrator, director of nursing, if there's some issues that you see or any concerns. First one.
Dennis?
Yes.
Oh, okay. Yes. I wasn't sure if you were showing us what you were talking about. I just saw a slide that said oops.
Yeah.
Okay.
So now we're actually going to get into some of the photos of actually some of these, okay? And I'll kind of explain so you can understand what the problem is here. We see gauges all the time on sprinkler systems. So this is a sprinkler system gauge, which is not a problem. However, this gauge was last checked and they wrote it on the surface, which you can, 2013. However, this photo was taken in 2019 and gauges need to be updated or replaced every 5 years. So it was non-compliance for that. And also they're into what would be a fire rated ceiling, and they used the red caulk for fireproofing around the actual gauge. And that is deficiencies on two accounts right there, just in one photo, 2 deficiencies. This is actually from an Illinois facility. There was a fire in the facility. The sprinkler heads in the room where the fire was did not discharge. So they had to do an internal investigation. Why did the fire not get put out by the sprinkler system? This is an internal investigation of the sprinkler system, which is required every so many years on wet systems. This is what they found inside that pipe. So you can see that water that's going down potentially to a sprinkler head would be clogged and no water would be able to discharge from that device in the room. Everybody was okay, but it caused a fire in that room and the sprinkler system could not put it out. So this is internal investigation because there's testing that's required every several years to find out if this is happening. This is one of these things you just see when you walk through a facility. A smoke detector hanging from the ceiling is actually a violation, and it would be tagged under the fire alarm devices. It needs to be secured to the ceiling because smoke rises to the ceiling, and if a detector is hanging below that ceiling, it would impede the alarm from sounding that could save time and potential lives in getting people out of a certain area, because the smoke alarm is not activated at a point until the smoke gets thick enough in the ceiling to actually activate that. So this is always a problem. This is another one. Many of you could probably guess where this is at. This is actually in one of the laundry facility inside of a skilled nursing facility because of all the lint and dust on it. These smoke detectors must be cleaned. They must be inspected and cleaned, if not by the facility, then the fire alarm contractor or a subcontractor that comes in and does these special cleanings. But those have to be cleaned because that also inhibits the smoke from entering the detector. This is a really unique one. The crown molding was precisely cut around a smoke detector, but this is in violation. It has to be separate because the smoke detector is actually in the proper place if they do a sidewall, but the crown molding cannot be like that. It cannot go over the top of a smoke detector. This is another one where it was bagged because they had, for some reason, there were issues with the smoke detector going off in this area. And so they, instead of finding out what the problem is and why it's doing that, they decided to bag it so it always read as clear. And potentially this would, if the room was smoke filled, this would not pick up any smoke at all. So there are other ways around this too. If they were having nuisance alarms, is maybe heat detectors can be placed in these areas. One area you'll see in many multi-story long-term care facilities, hospitals, is we find that they put storage. This is a ladder that's in an egress stair. You cannot put any storage in a stairway, stair exit tower. This is another one, hiding the exit. This happens more in assisted living. They're trying to hide the exit from residents that may be in memory care units, dementia, Alzheimer's units, stuff like that. So, because it is actually labeled as an exit sign, but you cannot put blinds over all the doors because nobody can see the hardware to exit. This is a photo that was taken here in Illinois, construction project. The door you see in the middle of between the windows was an active exit, emergency exit door from the building that was not blocked off because of the construction project. So if you open that door, you go tumbling down 20 feet of embankment. So that is a violation also. So that's why we look at, when we do the construction related reviews of drawings and projects and we go do interim on-site inspections, we see this, we would identify that on the construction side of things before it got to a life safety during a full survey due to complaint. But somebody could be injured severely from exiting that door in an emergency or multiple people going out. Electrical panels, there's a couple violations here. One, there's no cover on the electrical panel, and two, they're feeding the wire a main line coming in from the face of the panel and not through the side, so they couldn't even put a panel on there if they had. So this is actually a violation because that is an unsafe area for an electrician to actually come in and do work. In an emergency, somebody's reaching for an electrical breaker to shut it off because the power is out, whatever, they could be electrocuted. We find this quite a few times in facilities. This is one of those facilities where they were actually upgrading their fire alarm system. So this panel was uncovered during that week during the fire alarm rewiring some new fire alarm components. They just did not put the cover plate back on up above the ceiling. So that does happen, but it is a violation of the code. And this is just a mess of electrical above a ceiling we found at a long-term care facility. Exposed wiring, improper use of duct tape, electrical white no junction box against wood construction. Always a problem. You can clearly see the problem here. This is a construction project that was happening in a long-term care facility in Illinois. The contractor left for the day, decided to put their tile cutting equipment in front of the exit door and all of their 5-gallon buckets of sealant and joint compound in the stairway, blocking the exit. So that is a violation too. Even though it was done by a contractor, the facility is ultimately responsible. Just got a shipment in and it sat there all day. This is a violation. The exits have to be open. There is a time frame in which you can, minimal time frame, 15 to 20 minutes, you need to be unloading this, putting it away, then they can open that door up. But this, we took the picture in the morning, later that afternoon after lunch, it was still there. Violation. They were cited. Boxes in front of the exit doors, also a violation. This is one of the most interesting. If you look at this, it is technically an exit because it has an illuminated exit sign. It is a pull station, which is a exit from one building to either the exterior or to another building. So it is a required exit, but it says emergency exit only, but it's not an exit. And the signage even on the bottom says, please find an alternate location to exit. So very confusing to people in an emergency. Can I go through it or do I not go through it? So it's one of those interesting, this actually was from Colorado. So luckily we have not seen anything like this in Illinois, but this is from the state of Colorado. If you see a GFS can hanging from the ceiling collecting water, please notify the facility maintenance people. They need to correct this problem. This is not acceptable. As you can see on the panel, the hatch down below, how rusty it is. They've had water issues with this valve for a long time, and they decide to put the GFS can until it starts overflowing. Then they empty it and put it back up. This is from Illinois. Fires in resident rooms, smoke, and they wonder why. This is a unit that's on the exterior wall that runs the heating, sometimes the cooling through it, mostly the heating, the air fan units. But this was because one of the units in an adjacent room was smoking. Now they understand why, because look at all the debris. Nobody has checked these in years, and there's all kinds of debris in there, combustible debris could cause a fire. So that is a deficiency. This was actually in a hospital in Illinois. They wondered why they haven't replaced their filters for a while, because their flow rates across the filters were all reading good because the filter is not in place. So it's just allowing free air from the exterior directly down line into patient care areas. So this is absolutely a violation. Fortunately, this was not for a surgical unit because they have their own HVAC and mechanical requirements, but this was for a med surge unit. So storage in stairways, again, not permitted. Even the mail cart is not permitted in storage in elevators or in, stair towers. This is a problem that you may see. Sprinkler heads, and what they have used is that expandable spray foam. This expandable spray foam is not intended for use in commercial construction projects for stopping fire. Actually, this material is combustible. You can actually set fire to this. So twofold, they're using the wrong sealant. Two, the sprinkler head is actually being impacted because the vial, the glass vial that's in there, probably will not activate if the fire happens, that it could be impede the water source from coming out to extinguish a fire. So two issues with that. This is another one. This was a renovation project, so they can do renovation projects. The problem is they protected the glass vial by that orange device that's been sprayed over to protect that, but they didn't protect the deflector down below, the little prong thing around there. That deflector cannot be field painted. It has to be factory painted. So everything in this whole area where they did these, all these sprinkler heads had to be replaced because it cannot be field painted. Sprinkler heads cannot be field painted. This is just one that was crazy to us. That was actually from the city of New York. This is a sprinkler pipe for this area of the building, and they used 2x4s to support the sprinkler pipe from below. This is, and you can see all the storage that's happening back behind. These wood construction posts, 2x4s, can be easily knocked out of place and the sprinkler system damaged. All supports happen from above or sidewall. So this is in violation. This would be an automatic citation. Last winter, we ran through some issues with freezing conditions. This actually picture was from a facility in North Texas. One of my the AHJs that are on the committee for NFPA 101 is from Texas. This was one of the North Texas. This is how cold it got actually in North Texas last year during the real cold time we had in between December and January. It actually froze a sprinkler system in the facility, and the sprinkler system was freezing as it was trying to push the water out. That's how cold it was in North Texas. Construction site issues. This dumpster was not normally located in this spot, but what happens over time is as the dumpster comes in, goes out, they dump it, bring it back, it slides closer and closer to an exit door. This exit door was actually blocked and was an active exit door. It wasn't taken out of commission during this construction renovation project. So it's actually blocking individuals from exiting during an emergency. That is an absolute violation. That is all I have. Is there any questions? Anyone?
Okay, if there aren't,
Oh, hold on, I have a question for Dennis. Dennis, can you talk a little bit about the role that life safety plays with water system issues like Legionella and if anything that you do when you go out on a visit
Yes.
in maintenance of those issues?
Sure. Well, let's do this. Let's expand it a little bit too, to include mold and stuff. Because since we've had a more recent item and we've talked about that a little bit, so we'll kind of so on Legionella, we in design and construction and life safety, we don't go out and test for Legionella. What we do is the first line of defense is we discuss it with environmental health, okay, division, that they have individuals that they notify the county first, okay, if Legionella, if there's an outbreak. The issue we have is we don't have the proper testing stuff. We're not trained on being epidemiologists and stuff like that. So we always notify the environmental health if we hear of something, and they have guidance. And this really all started several years ago with the Quincy Veterans Home, as many of you probably remember. Some of the buildings, let me give you a little bit of background on Legionella. Legionella is everywhere. Some of the facilities, let's just say Quincy, some of those buildings are over 100 years old. The existing pipes that are in there, Legionella is in the pipes. Legionella, it's in our drinking water. But what happens is when it starts aerolizing into a mist, that's what becomes the real problem. Or mechanical systems outside, when you're out there and you see the big mechanical system pushing air, all the mist going up into the air, there's potential Legionella in that because of the type of systems those are. That's where it originally was found back in the late 70s. It was a Legionnaires in Philadelphia, I believe, that where it was originally found that some of these areas are contaminated based on mechanical systems and stuff. But anyway, the testing, we have to rely on other individuals to do the testing. We get notified of that. We would notify environmental health. We would make sure that the county is notified on this because they would bring in individuals to potentially test. Now, if it's there, they've had Legionella in the facility, they have to mitigate the problem. How do they do that? Well, you can't just replace every pipe in a facility, although Quincy is trying to do that over a huge project, but it could be in their city water supply where they get the water from, but they can only go so far. So what they have to do is there's protections that they can put on devices, like shower heads could have filters, sinks could have filters on them. But the problem we run into when we require them to do some kind of mitigation is they may not be able to come back the facility and replace those in a timely manner. Those filters, they only last so long, depending on how severe the Legionella is in the pipes. Those filters could maybe last 2 or 3 months. Then they have to be replaced. So facilities, saving money, it's not on their radar to replace them all the time because, well, we didn't know, that kind of thing. It's challenging to get them on a program that they can actually update and have it replaced all the time. So, because you don't want that to happen again. That's one of the challenges we have with Legionella. And then leading into that, we've had a couple of facilities, one recently that has had, when we say black mold, we do not test for that. Even environmental health, our own IDPH environmental health, do not test for black mold. A facility, when you walk in and you smell it, smells musty, kind of, you get that smell, it's probably there, but we have no way of citing them outside of, I think Jonathan had, we had talked about several ways about the environment and stuff like that. You could cite under that. And I think even Karen Singer in the hospital side said that there are ways that we could have them. They need to make sure they have a plan of correction in place for testing, checking, verifying what they have, because we cannot make them tear walls down to see what's behind the walls in mold. Even if we have a facility maintenance person that says, oh yeah, we've got mold behind the walls. Well, if you've already know that, that's how we have to cite these deficiencies, but we can't force them to take a wall down or ask any other, to do any destructive to get in and see what's going on. So Sheila, does that kind of help on the Legionella side of things? I know I didn't get into a lot of detail because we don't do a lot of that, but we try to notify the proper people in a timely manner.
Yeah, thank you very much. And I know I have a couple more questions, but there's a question in the Q&A.
Yeah, I saw one pop up. What was that?
Can you use a power strip for coffee pot, microwave, or fridge?
Sure. If the key is resident care areas, okay, that's really one of the big things, is because the power taps, when we plug them into they become tripping hazards, because in resident rooms, they're potentially laying on the floor. If it's in an area where it's not resident controlled and it's, say, on the counter and I need to extend down there, yes, I don't see where problems would occur with something like that, but it's more in that the care areas, resident access areas, activity rooms. We've seen it in activity rooms, dining rooms, because people want to they want to plug the light. They want to plug the lights in around Christmas time, but they can't get the lights. They use an extension cord, they use a power strip, stuff like that. That's where the potential problem comes in, because, oh, well, we'll tuck it in underneath here, but you have to check it every day, all the time. And that's where the problem is. So CMS has always said they need to be secured, or no extension cords, stuff like that. Or you need to add new power to the wall. That's the problem, because some of these older facilities, it's very challenging for power strips. I hope that answers the question.
I think there's a continuation. What about in the dietary office?
Inside the office, I personally don't have any problems with that. Now, the key is you cannot daisy chain these. If I have one power strip and then I plug another one in to get somewhere else, or an extension cord, that becomes a problem, okay? Because then you could be potentially causing a fire hazard with trying to get a bunch of them connected all together, because now all of a sudden I go from a duplex outlet that has 2 outlets, now I've got 6, now I'm plugging in another one, now I've got another 5 because I'm using one in the other one. So now I've got 11 outlets plus the one on the wall still. So that becomes a fire hazard. So you got to be careful how and where they're using them at. It's all about, everybody says, well, how is it, or is this a violation? If I see it, I know it, because I walk in and say, no, you can't do that. If I see one that's tucked in underneath a desk or something like that, okay, I'm okay with that. If it's in non-patient care areas, they just can't be extension cords and power strips, because we all have power strips and everything's going to LEDs now and low voltage stuff. So it's a little safer, but you just can't have them in those patient care areas.
Thank you, Dennis.
Yeah.
One question, and then we have another question inside of the Q&A. Dennis, can you, with the winter time coming, elaborate a little bit more about the temperature requirements in the facility residential areas?
Yes. Our licensure rules, I don't have it right in front of me. Our licensure rules state a low of, which is probably needs to be updated, but it's been in there for years. A low of 55 degrees, you can still have residents in there. 55 degrees to you and me may be okay, but some residents, it's too cold. But they got to figure out, but the maintaining the temperatures, I believe our licensure rules state between 70 and 75 degrees. It's only those times where 55 degrees, because then you've got to have an action plan, evacuation, what's going on with the mechanical system. But so 55 is in there, but 70 to 75 degrees is kind of the national standard, because even with the ASHRAE requirements have that standard in there, 70 to 75. It depends on what ORs may be a little different, if you're in a hospital, stuff like that. But comfort for residents, 70 to 75 degrees. So if you walk in and the facility has heating and electric, and this is another one of those challenges too. They have a heater. We've seen this already. Boilers are going out already in the last month. We've had boilers going out that may affect a certain area of the facility. They want to bring in heaters. What kind of heaters? How are they plugged in? You can't bring in a combustible heater, with propane or gas fired. So they're bringing electrical. Now they're running extension cords in the hallways and that as a temporary emergency to figure out what you're doing with residents, but it's not the final solution. They can't be running extension cords all over the corridors for their heating an area until they get their system fixed. They have to come up with a way to either move residents out into areas. We've seen them move them into dining areas temporarily, and other areas of the facility that may still be warm until they figure out the problem. But otherwise, they may have to evacuate certain areas of the building. And if they don't have the room for it, they may have to find sister locations or family to come in and take them out.
Okay, Dennis, there is a question in regards to a tag. It says that they were tagged for power strips in the activity office. And IDPH said that we can't use power strips in the office. It's not patient care areas.
Yeah, I'd have to talk to Bill Myers about that and see. Yeah, because I didn't see it. I don't see the tag exactly, if I knew more, but I'll talk to Bill about that, because if it's not a patient care area, if there's any chance that a resident or patient, depending on what facility type we're in, has access to those areas, that could be a problem. So it just depends on how they're using it and utilizing it. It's hard for me to answer some of these because I didn't see it. I don't know the exact context of the tag that was written, but certainly Bill and I have had conversations about these in the past. So if there's any issues, please have anybody can email me and I can bring it up to Bill and we can kind of discuss it. And believe me, if I'm wrong in my interpretation, I'm a big person. I will admit that I'm wrong in my interpretation. But we have seen them in hospitals before, non-patient care areas, as long as they're rated for what their use is. That's the key.
And then the last question, Dennis, is it says that our facility has 7 a.m. to 7 p.m. and then 7 p.m. to 7 a.m. shift for nurses, and the
Mhm.
rest of the non-nursing staff schedules overlap during this time. It says light kitchen staff 6:30 to 2:30. Are we required to do 3 fire drills or just 2 in this case?
No, that's come up before. The code states, I believe it's every shift, every quarter. So that depends on how, and I'd have to get out, I could get out the code and review that, but I think it was every shift and every quarter. Hold on a second, maybe I can find this real quick. If I can't find it that fast, I may have to.
Dennis, what you can do is you
Yes.
can just add it to your PowerPoint when we post it on the website.
You got it, because I was actually going in the
Okay.
the
Okay.
2786, form, because CMS has guidance in there on it, on the form. So I was actually going to look at that. So yes, I will do that. Okay.
We have one more question that just came in.
Yeah.
It's fridge and microwave must be directly plugged into the wall and no power strips.
In what, I mean, are we talking about in the dietary area? And I mean,
Yeah, it doesn't say
or
specifically.
is it my little fridge that I have in my office? You see what I mean? I'm trying to, because there are maybe some context there. Most of the equipment should be plugged in directly to an outlet in the wall. That's where older facilities may not have the same number of plugs that they need. They may be required to put an additional plug in. It just depends, because if I can access a power strip, and I'm not hiding it, because if I can't see the power strip, I didn't even know it was there. People get hired, new people, they don't even know, and it could potentially cause a fire hazard. If it's in an office and you're using it in an office or on a counter or something like that in a non-patient area, I can see it. I know that it's not tripped. I can see that. But it's the problems with, in some of these areas of dietary, they push everything against the walls. You can't see anything. So it gets lost and forgotten.
Okay.
I think that, Dennis, there's a lot of questions about power strips.
Yes.
And maybe if you could add a slide about power strip usage to your presentation, and we can post it, then we can get some more clarity, or when we have you back again.
Yes.
Okay.
Yeah, absolutely. Yeah, CMS has guidance, S&C memos on power strips and their use. So even CMS has guidance on that. So from years ago, and they haven't changed their policy on some of that. So I'll try and incorporate that S&C memo. It's open for the public to see. So
Okay.
all right.
And just for everyone that are asking questions in regards to whether or not the slides will be available, the slides will be available on the website. And there is a link in the chat if you want to go directly to that link, but we will have them available on the IDPH website if you have any additional questions.
Yes.
All right. Thank you, everyone, for attending this webinar. We will have future webinars coming up, so we do ask that you sign up, and happy holidays to everyone.
Thanks, everyone.
Thank you, Dennis.
Bye.